Hello everyone. Welcome to today's webinar. You don't need a home to vote. Election year activities for HCH projects. This is organized by the National Healthcare for the Homeless Council and made possible in partnership with the Health Resources and Services Administration. My name is Dan Rabbit, policy staff at the Council. I'll be acting as today's moderator. So today's webinar will be a 1-hour presentation with the last 15 minutes reserved for Q&A, and a select number of questions will be answered at the end. As mentioned, today's webinar is You Don't Need a Home to Vote, Election Year Activities for HCH Projects. We have an excellent panel of speakers today. First, we'll have Michael Stoops, Director of Community Organizing for the Washington, D.C.-based National Coalition for the Homeless. Since 1972, Michael has been working full-time on homelessness advocacy, serving on the Coalition's Board of Directors since the mid-80s and joining the staff in 1988. Michael has worked to establish and provide ongoing support to local, statewide, homeless and housing coalitions and homeless self-help and social justice action groups. He is the project director for the Coalition's National Homeless Civil Rights Organizing Project, coordinates the Faces of Homelessness Speakers Bureau, the National Homeless and Low-Income Voter Registration Week, National Hunger and Homelessness Awareness Week, and National Homeless Persons Memorial Day. We will next have Marc Wetherhorn, the National Advocacy Director for the National Association of Community Health Centers. Marc entered the advocacy world in 1986, working on the U.S. Senate campaign and then in the office of Congressman Weiss Fuller. After leaving the senator's staff, Marc founded and ran Georgia Citizen Action, a grassroots consumer and environmental advocacy organization with over 15,000 members, and later served as Southern Regional Director for Citizen Action. Marc joined the National Association of Community Health Centers in 1999 as its National Grassroots Coordinator and currently serves as National Advocacy Director. In that position, he is responsible for overseeing NAC's network of grassroots health center advocates and NAC's Community Health Vote Civic Engagement Campaign, which Marc will be talking about shortly. Marc also supervises NAC's field representatives and is responsible for all National Health Center Week activities. Following Marc, we will have James Kowalski, outreach worker for the PATH team at Heartland Health Outreach in Chicago, Illinois. He primarily works with people experiencing homelessness who also suffer from mental illness, provides linkages to housing, healthcare services, and benefits. For the past 2 years, he has served as a deputy registrar for the Chicago Board of Elections, and in this role has registered many Heartland Health Outreach clients to vote. Finally, we will have Joseph Benson, volunteer and community outreach staff for Search Homeless in Houston, Texas. After experiencing homelessness himself, Joseph has gone on to be a member of Healthcare for the Homeless Houston's Board of Directors, been the chair of their Consumer Advisory Board for the last 5 years, helped to create the Consumer Advisory Board for the Coalition for the Homeless Houston, and is an advisory board member of the Center for Social Innovation. Joseph has worked to assist homeless individuals to register to vote and has even secured transportation to get them to the polls, incorporating this into the goals of his Community Advisory Board. We're very lucky to have these speakers with us today, and I think with that, we'll just get started with the presentation. Here you see an overview. And now I'm going to pass it over to Michael Stoops. Michael?
Good afternoon. The National Coalition for the Homeless is 30 years old in the early 1980s. When you think about it, voting, we all know that voting is very important. Even though homeless people don't have money, they do have people power. And homeless people, for the most part, tend to be in certain geographical areas of a city, commonly called Skid Row, which increases the power of the homeless vote. Every election is important, not just presidential elections, but city, state, county, and federal. Voting is very empowering for homeless individuals. I've known homeless folks who would be so glad when they got their voter registration card, as it was the only piece of identification that they had. We got the idea for our campaign from the late mayor of Atlanta, Maynard Jackson. the airport is named after him. And he once told a group of homeless activists, why should he listen to homeless people? Because homeless people don't vote. And that made us realize that we needed to get the word out and to let homeless people know that even if you're living outside, you can still register to vote. Homeless people are underrepresented in decision-making processes at the local, state, and federal level. For participation, as you can see from the slide, the participation rates of low-income people are the lowest of any financial category, and probably the homeless even have a lower turnout than the overall low-income population. We all know, people who work with homeless people, that there are barriers that homeless people face. One is no fixed address, or not having a mailing address, or moving around a lot. And we all know that not having a driver's license can be a barrier, and we have found that 15% of low-income people nationwide lack an ID. Among the elderly, it's 18%. Among African Americans, it's 25%. And even young people, 1 in 5 young people do not have an ID. A criminal record in some states can be a barrier, the lack of education. But I can tell you, if there's anything good about being homeless, is that you have time on your hands, and you're in the library, you're on the computers. Most homeless people I know, they know who is the vice president of the United States. But the biggest barrier is, and why it's not always the most important priority, is that homeless people are trying to survive either on the streets or in shelters. Our efforts in the 1980s, in 1984, there were 4 successful court cases in which homeless people won the right to vote in Washington, D.C., Philadelphia, New York City, and in Santa Barbara. In 1984 and 88, Reverend Jesse Jackson Sr. with the National Rainbow Coalition and Human Serve, which is an organization to turn out the low-income vote, did really organized voter registration, education, and get out the vote efforts with low-income people nationwide. And those groups led to getting the National Voter Registration Act passed and signed into law by President Clinton in 1993. The You Don't Need a Home to Vote campaign was launched in 1992, and again we chose the names just so we believe that everybody should have a home, but we wanted to get the word out that even if you don't have a home, you can register to vote. Throughout the 1990s, we were able to get 11 states to add language to their statutes about the right of homeless people to vote. And if people would email me, I can tell you the states in which we got legislation passed. Our campaign in 2012 is a combination, very standard, voter registration, voter education, get out to vote, and legal rights issues. And that means monitoring how homeless people are being treated at the election polls. Voter registration is more than just doing a drive, and we encourage you to get other agencies involved and to survey local agencies to find out, have they made voter registration a standard part of their intake or exit interviews. And we would also encourage people to
just heard, however you choose to communicate it, you have to make sure you do it in a very nonpartisan way.
So the rules that you have to pay attention to that your organization as a nonprofit can do is you can do voter registration, you can do voter education, you can distribute sample ballots or guides for folks on how to vote, you can co-sponsor candidate forums, you can invite candidates into your site to see what you do, you can do anything to remind people to vote, you can help them vote on election day, you can recruit folks as poll workers. In a lot of communities, the registrars are looking for people to help in the process, and they actually get paid for the day. You can also support or oppose ballot issues. What you cannot do, and what I said before, is you can't endorse a candidate. You can't give any resources to candidates. You can't rate a candidate just on the issue that you care about, homelessness. If you're going to rate candidates in a scorecard of some kind, you have issues, and you absolutely can't tell people how to vote. Next. So at health centers, how do we propose to do it? And this may be different at your sites, but the basic principles apply. The first one of which is voting is the key, not just registration. Do registration combined with some other activity. Updating people's registration, and again, for those who are homeless, some of them may have been registered to vote at their old address if they just recently became homeless. They need to update their registration or they won't be allowed to vote except in a provisional ballot. And people pay more attention the closer to the election. That's why your low-income voter registration week is right before the deadline for registration closes in most states. Obviously, there's more on television about it. There's more energy. So folks actually pay more attention the closer you get to the election. At health centers, and again, at sites that provide services, integrating it into your activities is really the best way to do it. Have somebody at the site responsible to be able to coordinate the activity. Make sure, and this was mentioned before, it's really important that you talk to your county registrar to find out whether there are any rules, anything you have to do in order to be able to do this effectively. In some states now, they've passed some really significant laws that restrict voter registration drives that may make it difficult for you to collect the registration forms yourselves. You may have to find a way for them to be sent in, or you may have to have, as was mentioned before, have somebody designated as a registrar to be able to do registration effectively. You need to learn those because they vary from state to state, and in some cases from municipality to municipality. Ask everybody if they want to register to vote or update their registration. Staff and volunteers for your site may often not being registered to vote. The last time we did this, we found an awful lot of staff members who weren't themselves registered or hadn't updated their registration. And again, I mentioned National Health Center Week and National Voter Registration Day as times when there'll be real visibility around doing voter registration. One of the other things we recommend is obviously making it visible. I talked about this before. When you talk about get out the vote activity, one of the issues is if you register folks but they don't come back into your site again before the election, how do you remind them to vote? How do you communicate with them? So if there's a way to find ways to follow up with the folks that you register, that's always helpful. And if they are coming back into your site, remember that you need to continue to talk about it, to talk about the election, so that they actually do vote, not just register. Again, making sure that any completed forms get submitted and get submitted on time is really important. Learn how long you have to turn them in. In some cases, it's only 48 hours to turn in the voter registration forms, or you're liable to some sort of action or fine. We also will be tracking the number of people that we register, and actually in many states matching them against the voter files to make sure that they actually got registered and to be able to find out if they voted in the election. We won't know how they voted, but we will be able to know whether they actually voted. I only have this slide up there. It's really for health centers or any folks I think that get federal grants or that engage in enrolling folks in public assistance, The National Voter Registration Act, Motor Voter, actually has a provision that requires any organization, any site that enrolls people in public assistance using state or city or county employees, they are required, just like the Department of Motor Vehicles, to offer voter registration. So if at any of your sites you are actually enrolling people in public assistance, that process requires that you ask them if they want to register to vote and to assist them in doing so. If you don't use state, county, or public employees to do it, you still can do it. And so really what this says is that people should not be scared of this activity. They just need to make sure they do it the right way. Again, and that's what this says, emphasize voting in your registration for public assistance. The staff that do any enrollment need to be trained, and there needs to be a form so that people can opt in to get further information or that they can get follow-up. Education, again, our goal is to make these folks that we register not just voters but advocates, to make sure they vote, to find ways to involve them in the process in a lot of different ways. Highlight them in your organization's communications. I think especially for the homeless, one of the things we found out of doing this at some sites a few years ago is that the actual process of voting can be extraordinarily intimidating. If you've never voted before, going to some place you've never been with a bunch of strangers to stand in line to do something you've never done, especially if it's electronic voting, can be extraordinarily intimidating. So some way to educate folks, to make them comfortable with the process of voting, is also something we're encouraging centers to do. And in some states where there are voter ID laws now, you need to make sure that you have a process for making sure that the people you register actually are able to vote. And if they need an ID, you need to know how they get it and whether or not you can help them get it. So again, you can educate folks on how to vote, whether they have voting by mail, paper ballots, they have special circumstances, whether they're ex-offenders, whether they have a disability, whether there's a language issue. If they're 17 years old but will be 18 by the date of the election, they can still register to vote. A lot of folks don't know that. And so all of these things are part of our education effort on how to vote. Again, for our purposes, we want to try to capture people's information that's maybe far more difficult at a healthcare for the homeless site. But we want to try to follow up with them in as many ways as possible. We want to have information that we can give them so that they know when and how to vote, and we can follow up with them on how to do it. We're trying to provide as many national resources as we can to help. We're working with a number of other organizations. The Fair Elections Legal Network is providing legal advice, especially on these state-related issues. Nonprofit Vote is another organization that provides information and webinars for all kinds of nonprofits. Turbo Vote actually has created for us an online voter registration tool where rather than having to actually fill out the complicated, sometimes registration form, you can fill out a very simple form online and it populates the registration form, which you can then print out and sign. State Voices are organizations in various states that do a lot of coordinating of voter registration activities. And then the National Council of La Raza, we are working with them especially around efforts to educate and to register Hispanic voters. So in our experience, what does it take to be successful at this process? One, it has to be an organizational commitment. This is really not something that one or two people at an organization are going to make happen successfully. You really need to have the commitment of the board and the staff of your organization, and they have to understand how important it is that you do it. The other thing is somebody at your site, somebody at your organization has to take this on. Somebody has to want to do it, to be responsible, and to make sure that all the things you need to do get done, all the information you need to have is available. Who's going to get the registration forms? Who's going to make sure they get turned in? Who's going to be available to answer questions when they come up? You need to have somebody who really wants to do that. You need a plan. How are you going to do this? You can't just pick up a bunch of forms, slap them down, and ask people to fill them out, not be able to help them, not know what to do with them, not know the important dates. you really need a plan to do this successfully. And in this case, you need support. You need support from the Healthcare for the Homeless Council. You need support from folks like NAC, from primary care associations, and other partners. And I just want to, let people know that we are certainly committed to providing as much assistance as we can to everybody. I have some important dates of our own this year that we wanted to highlight, and they work backwards from Election Day. It's November the 6th. Our early voting periods vary by state. That's something else you need to know. Registration closing dates, they also vary by state. They're not always October 6th in every state. National Voter Registration Day is September the 25th. National Health Center Week is August the 5th through the 11th. And we kicked this whole effort off on March the 21st earlier this year at our Policy and Issues Forum. And I put this slide in here. Nobody made a greater mistake than he who did nothing because he could only do a little, because I think it's really important that people understand you don't have to put in place a great activity. What you need to do is you need to make sure that you're doing something. Every little bit will help. And just, I call this the power of large numbers, and this could apply to any site. But if every health center site in the country, there are 8,000 sites. If each one registered one voter a day from May the 1st through October 6th, health centers would register 1 million new voters. So again, every place doesn't have to do a lot if everybody would do something. And then the last thing I want to point out is that we have a toolkit that you can download that will help you with this process. We do have online voter registration at our site, and while this is a long URL, you can actually now just go to www.chcvote.org and access all the information we have available. So now I would like to turn it back over to Dan.
Hey, thank you, Mark. And just as a reminder, these slides will be available on our website for future access. So if you didn't scribble down a URL or you missed an email address or something like that, it will always be available on our homepage. Now we're going to go to James Kowalski from Heartland Health Outreach to hear about how he does it at his specific, how he does voter registration engagement at his specific project out in Chicago. James?
Thanks very much, Dan. So as Dan mentioned, I am an outreach worker and case manager at Heartland Health Outreach in Chicago. Our company actually provides healthcare and support services for people who are experiencing homelessness. On the second floor of our building, we have a clinic that provides primary mental health and dental care. And then in other offices throughout the building, we provide case management and some of other support services, such as a resource center where group counseling is available and offered for our clients. So in addition to my work doing outreach, about 2 years ago I took on the responsibility of becoming a deputy registrar and have been registering our clients since that time. I partnered with the Organization of the Northeast, which is a community organizing group up here in Chicago, and they do voter registration drives. They do So the process is pretty simple. Once I was registered to vote registered to be a deputy registrar, I would usually, a couple months in advance of an election, will make announcements in our resource center, which is where we do our group counseling. I'll make an announcement at the community meeting, which happens on a weekly basis. I'll also put up flyers in the resource center and in our clinic. And I will make open walk-in hours where I'm available to register people to vote. Usually something repeating, so like once every 2 weeks for about 2 hours at a time. You can get an idea that it's pretty basic information that you need from someone. I have somebody fill out the pink form, and then I copy it onto the yellow form. That yellow form includes a carbon copy, which I give to the client, and that serves as their registration card until their actual voter registration card shows up. Once I have a collection of registrations done, I put everyone's name and address on this white form, and from there I submit that to the Organization of Northeast, and they submit it to our Board of Elections. And this first picture is one of our happy customers. This is a client up in our resource center with her voter registration card. So I think it's good to inform clients, first off, as we've been saying, that they are eligible to vote. In our case, many clients will use our company's address as their voter registration address. Also, for those of our clients who are fortunate enough to get housed within the last year or two, you can remind them that they can register and update their registration, as Marc was talking about, if their address has changed. Another barrier, I think it was Michael who was speaking about the barriers regarding addresses and IDs. So for Chicago, I know that people are required to have 2 forms of identification, and one of them needs to have a picture on it. So for instance, if somebody shows up with a state ID which has their picture on it but doesn't have a second form, if they're being treated in our clinic, I can have medical records printed off from our clinic and use that as their second form of identification, because I will have their name and their address on it, on their chart summary usually. Or if they come in with a piece of mail which has their name and their address on it and need a picture ID, we actually make participant IDs here at Heartland. So there are some ways to kind of work around these barriers and help people overcome them. I think as far as what Marc was talking about not endorsing any candidates or anything like that, generally if people have questions about candidates and their specific stances on certain issues, the one that I like to use, they usually have pretty good summaries and explanations of candidates' viewpoints. In addition to that, I'll usually give out some paperwork, first off, letting them know when the upcoming election dates are going to be, and also giving them some information about ONE, the organization that I work with to do the voter registration, so that if they want to get involved just beyond registering to vote and voting in the election, they have a community organizing group that they can get involved with. I think some of the reasons for doing this have already been touched on, and I just wanted to emphasize that I think that doing a voter registration with somebody is a very satisfying process, I think, for the client and for myself as an outreach worker. As opposed to many of the things that we do in our line of work that is very slow, incremental progress, registering someone to vote takes about 10 minutes. They'll get their voter registration card in a month, and it's a very genuine form of empowerment for our clients to have. So I do think it's a very valuable service and does not consume too much time or energy on our parts to be getting people registered to vote and encouraging them to go out and vote around Election Day. I think as far as how this can be applied to other parts, so some things we've explored was doing registration through our clinic directly. And I've spoken to some of the people who work on the registration desk downstairs at our clinic. And I think their opinion is that right now, with just registering people and getting them signed into the clinic, that they're too busy. But they suggested possibly looking into having interns do it. So I think that's another source of registering to people to vote could be if there's interns at your site, that they might have more time on their hand, and they might be able to register people to vote with their time. So with that, I will hand it back to Dan, and I'm happy to answer any questions at the end. Thanks very much.
Hey, thank you, James. That really does help to kind of clarify what we're talking about here. Much appreciated. Now we're going to pass it on to Joseph Benson out of Healthcare for the Homeless Houston. Joseph, please tell us what you guys do down there.
Thank you, Dan. My name is Joseph Benson. Most of you might know me as Cowboy. I'm here in Houston, Texas with Healthcare for the Homeless Houston, and I am the chairperson of our consumer advisory boards. One of the things that we do here in Houston is that if a person joins the Consumer Advisory Board, we ask them to become a deputy registrar. And that process is really easy. They go and they take maybe this approximately 10-minute class that you take, and it goes over the things, a lot of the things that you have heard already. Especially the main thing is that you cannot endorse a candidate, and you cannot endorse a specific party. And one of the things that we try to do, well, the goal that we've made here in Houston is that we have 14,000 individuals that's homeless. And we would like to get all 14,000 registered. And that way I can go to the city council and let the city council know that those individuals that you have been calling those people, they are no longer those people. They are now your constituents, and those constituents can vote you out of office. One of the things that I like is if you would go to the National Healthcare for the Homeless Council and go to consumer, you can go onto that particular website, and they have a site to say enfranchising the homeless community. I think you can't, voting is one of the best ways to enfranchise the homeless community because, once you become homeless, individuals constantly telling you that you don't have any worth. And that's not true. You do have worth. And one of the ways to show your worth is to vote, especially in local elections, state elections, and in the federal elections. When you go to the council website, they have a letter that you can use. If, say, for instance, you have an affair, and they have a letter that's already written out, and the only thing you have to do is fill in the blanks and send it to a candidate and ask that candidate to come to that particular fair and let them know what type of questions are going to be answered, and the question that's going to be asked of that particular candidate is on that particular website where it's saying franchising the homeless community. And they're going to have questions that you're asked about, like health care, housing, income, disability, and addiction. One of the things that we struggle with here in Houston is that working with ex-felons. The state law, and it varies from different states, so you'd have to go to your state laws and go through your state laws and find out what rules they have for individuals that has been incarcerated. Here in the state of Texas, once you have finished your probation or parole, you do not have to write the governor. You automatically just fill out a voter registration form and you can start voting. Our big thing is to, like I've heard throughout the webinar, is that, people have tendencies to use the voter registration card as the second ID, which is a great thing, but we want them to be able to go vote. We need them to go and actually vote. And what I've done, I've worked with different transportation companies here in the city of Houston, and they're willing to take our customers to the polls and to vote. I've also made relationship with one of the polling stations, and they were willing to accept our group coming in as early voters, because where we're located at, it's a little intimidating to go to that particular poll site because we're in downtown Houston, and as you know, it's going to be police officers and different things there, and that intimidate our clients. So we try to get them to go to as friendly places as possible. Basically everything, I'd like to just reiterate the things that's been said. It's basically the same. It's just like in Chicago. What we do is when we have them fill out the form, we give them a copy. We keep a copy, then we put their names on the enrollment form, and then we take that enrollment form to our tax executor and make sure that their names is on the registration form, so when they go to different places that they can vote. Dan? That's it, and I'm going to turn it back over to you.
Hey, thank you so much, Joseph. That brings us to a close for our formal presentation. We're going to now open it up for questions. Joseph, can you talk a little bit about how you incorporate your voter registration efforts into the clinic that you are the Consumer Advisory Board at? Like where in the lobby you do it, how you've gotten the resources and the space and the buy-in from the staff there to do it?
Oh, yes. Well, it was easy for me I was fortunate enough to get hired by the organization that helped me recover. And with me being a staff member, I was able, and then I decided to get it started. What happened was that a few years back when they had the convention in New Orleans, the National Healthcare for Homeless Council had the convention in New Orleans, I was put between two persons to have lunch. Loeb out of Colorado and Paul Bowden out of California. And they had all of this information about voter registration, and they were going back and forth across me, and that kind of set a fire up under me. So when I showed back up at my facility, I had all of this paper and information about voter registration, and my CEO looked at me and said, okay, well, Joseph, you're so fired up about this. This is your baby. Go ahead and do it. And we're fortunate enough that we have town hall meetings once a month, and at every town hall meeting, I get up and I talk about voter registrations. Then I decided that for the individuals that become part of the Consumer Advisory Board, I asked them to become part of it by being a deputy registrar. In that, it made it possible for me to have an individual that's in our resource center from the hours of 8 o'clock in the morning until 12 every Monday. And I just don't do it for because we're having a national election or you have a state or city election coming up. This is every Monday throughout the year. 52 times a year we do voter registrations. And we're there to help those individuals and kind of guide them in taking the effort of becoming a voter and to register to vote. And then we make sure that when their mail come through that they get that. And then I constantly talk to them about going to the polls in order to vote, not just to use that card as that second form of identification. Dan?
Sure. Yeah, thank you so much, Joseph. I think that's very important to point out that this can be incorporated into the work you do year-round. It doesn't have to be a every 4-year presidential election sort of a thing. Next, we have a question from Rebecca Ain asking about the name of the place to refer clients to for voter information and information about candidates' positions. I'm going to give that over to you, James.
Yeah, the website that I usually hand out to people is called votesmart.org. So VOTESMART.org. It's unbiased, gives information about the candidates, background information, as well as, usually closer to the election, it'll have a lot of information about where they stand on specific issues. So that's the resource that I usually use.
Yeah, thank you, James. That is a great resource. It's nonpartisan. It's just factual about what the different platforms and positions candidates have are. Next, we have a question from Matt Tillery. It says, what is the best way to find local and state voter registration laws? I'm going to give that to you, Michael.
I would check with your Secretary of State, who generally is in charge, in most states, in charge of the state elections office, and that would be the place to start. But again, every county has an elections office, local people, and you can go into the county elections office to find out what the laws are for that certain state.
Okay, yeah, thank you, Michael. I also know if you go to www.vote411, VOTE, letter 4, or number 4, number 1.org. They have, or you go to our website, the National Healthcare for the Homeless Council website, under voter registration. And there's like a widget. There's a place where you can enter in your information, and it'll print out a whole bunch of information about voting or election day information, identification information, candidate information, and I found that to be pretty helpful. Next, we have a question from Marcine Hill asking if you can send for posters encouraging voter registration to display in their clinic. I'm going to put that to Marc. Mark, do you have information about some voter registration displays?
Well, it depends. I mean, I think we hope to have available posters and buttons that people can use, and will be around our community health vote effort. But yes, we also are looking at the possibility, and this may be something, you know, some folks will do locally, is we're actually looking at having a contest to have people design posters that urge people to vote. So I would say if you keep an eye or go to our www.chcvote.org site, you should be able to see some place where you'll be able to order posters and buttons and other materials probably in the next 2 to 3 weeks.
Yeah, that's great. Correct me if I'm wrong, Mark, but I seem to remember that nonprofit Vote had posters that you could order for free. Do you recall if I'm remembering that correctly?
They used to have, but I don't know if they will have this year. You can go to their site, nonprofitvote.org, and again, check and see. They do have a store there. I just don't know whether they're free or not.
Okay. Thank you so much, Mark. Next, we have a question from Robert Mason asking about contact information for human rights organizations in Atlanta, Georgia. I'm going to kick that to you, Michael. Do you have any information about that?
I would contact the local homeless coalition, the Metro Atlanta Task Force for the Homeless. They run the largest shelter in Atlanta on the corner of Peachtree and Pine. And there's also a statewide homeless coalition called the Georgia Coalition to End Homelessness there in Atlanta.
Okay. Yeah, thank you so much. I'm going to advance us along to the next slide. Here are some resources that I wanted to point out. This first one is the National Healthcare for the Homeless Council's voter registration page. We used to have voter registration information in a couple different places, and we recently consolidated it onto this one page. It has that widget from Vote 411 on it. It has the National Consumer Advisory Board manual, enfranchising homeless clients manual. It has links to Community Health Vote and the National Coalition for the Homeless and a few other national public interest kind of groups. And it's a pretty good one-stop shop for homeless, healthcare specific, or more general voter registration information. We also have up here Community Health Vote, which Mark has referenced extensively. That's the National Association of Community Health Centers voter registration hub and campaign for this year. We also have the Coalition, National Coalition for the Homeless's voter registration manual and nonprofit Vote. These are just a couple of the numerous resources that are out there. I think this is actually getting a little more attention than usual because of all of the new voter fraud, quote unquote, if not voter suppression laws that have been proliferating around the country, making it more difficult to register people to vote, making it more difficult to actually vote, putting in place more requirements. I think it's actually put more of a spotlight on this, and hopefully we can maintain that amount of momentum. If you have any questions about this going forward, you can always contact me, or I know Mark's email was in previously in the PowerPoint, or Michael. All three of us are doing plenty nationally to try to promote this, and we really are happy to hear from anybody who has questions or interest in trying to integrate this into the work you're already doing. So with that, I think I'm going to bring it to a close. Thank you guys so much for attending. Thank you to our wonderful speakers, and good luck in being a good citizen out there. Thank you very much.